ethinyl estradiol plus norethindrone. This is written in clinical style for study reference, not as medical advice. Junel, comprehensive drug monograph, very detailed. Number 1. Generic name, drug class, brand name, drug forms. Generic name, ethinyl estradiol, synthetic estrogen, norethindrone first-generation progestin, ferrous fumarate, non-hormonal iron tablets. Drug class, combined oral contraceptive, COC, estrogen-progestin combination. Brand names, Junel 120, Junel 1.530, Junel FE 120, Junel FE 1.530, microgestin, similar formulation, Lostrin, similar formulation. Drug forms, oral tablets in 28-day packs, 21 active plus 7 iron, FE tablets, 24 active plus 4 iron tablets. Strengths include ethinyl estradiol, 20 milligrams or 30 milligrams, norethindrone, 1 milligrams or 1.5 milligrams, ferrous fumarate, 75 gram placebo with no hormonal effect. Number 2, definition. Junel is a low-dose combined oral contraceptive, COC used to prevent pregnancy. It also provides benefits like menstrual regulation, reduced menstrual blood loss, and treatment of hormonal acne. Number 3, mechanism of action, very detailed. Junel works by affecting 3 major reproductive targets. A. Inhibition of ovulation, primary mechanism. Ethinyl estradiol plus norethindrone suppress FH and LH release from the pituitary gland. Prevents the LH surge, thus blocking ovulation. B. Thickening of cervical mucus. Progestin causes. Mucus in cervix becomes viscous and thick, prevents sperm penetration into the uterus. C. Endometrial effects. Endometrium becomes atrophic and not suitable for implantation. Lighter periods occur because of thinner lining. D. Tubal motility changes. Slows fallopian tube transport, added contraceptive effect. Number 4, pharmacokinetics, PK. Ethinyl estradiol, absorption rapid, 38 to 48% bioavailability, first pass metabolism, peak plasma 1 to 2 hours, distribution highly protein bound, albumin SHBG, metabolism, liver CYP3A4, extensive conjugation, half-life 13 to 27 hours, excretion urine major, feces minor. Norethindrone, absorption rapid, Tauber 65% bioavailability, peak plasma 1 to 2 hours, distribution binds to albumin, partially to SHBG, metabolism liver reduced and conjugated, half-life 7 to 14 hours, excretion urine and feces. Steady state, achieved within 5 to 7 days of daily dosing. Number 5, uses, clinical uses and off-label FDA-approved use, primary contraception. Common non-FDA but widely accepted uses, treatment of dysmenorrhea, treatment of acne, mild to moderate, menstrual cycle regulation, management of PMS/PMDD symptoms, treatment of endometriosis symptoms, reduction of menorrhagia heavy periods, perimenopausal cycle control. Number 6, indications. Junel is indicated for prevention of pregnancy in persons who can become pregnant, may be used for cycle control and menstrual regulation. 7. Contraindications, detailed list. Do not use Junel if any of the following are present: cardiovascular, clotting, current or past deep vein thrombosis, DVT, pulmonary embolism, PE, known thrombophilia, e.g. factor V Leiden, stroke, TIA, or heart attack. Migraine, migraine with aura, absolute contraindication. Blood pressure, severe or uncontrolled hypertension. Smoking, smoker 35 years old. Liver, acute or chronic liver disease. Liver tumors, benign or malignant. Cholestatic jaundice during pregnancy or past OC use. Cancer, breast cancer, current or history. Estrogen-dependent tumors. Pregnancy, known or suspected pregnancy. Others, unexplained vaginal bleeding. Hypersensitivity to components. 8. Precautions before taking Junel. Tell your healthcare provider if you have metabolic conditions, diabetes, risk of glucose intolerance, high cholesterol, triglycerides, neurologic, any type of migraine, seizure disorder, drug interactions with anti-epileptics, psychiatric, depression or mood disorders, GI, liver, gallbladder disease, history of hepatic enzyme abnormalities, reproductive, breastfeeding, estrogen may reduce milk supply, lifestyle, heavy smoking, obesity, BMI 30 increases clot risk. Number 9, how to use Junel, detailed instructions, general rule, take 1 pill every day at the same time. Starting Junel option A, day 1. Start on day 1 of period, immediate protection. Option B, Sunday start first Sunday after period begins, use backup protection for 7 days. Option C, quick start today regardless of cycle, use backup for 7 days. During the pack, active pills contain hormones. Fe pills contain iron only, no hormones. Bleeding typically occurs during Phe placebo pills. Number 10, dosing information, common formulations, product, norethindrone, ethinyl estradiol placebo, placebo, 10120, 1 milligrams, 20 micrograms, none. Junel 1.530, 1.5 milligrams, 30 micrograms. Junel Fe 120, 1 milligrams, 20 micrograms, 7 Phe pills. Junel Phe 1.530, 1.5 milligrams, 30 micrograms, 7 Phe pills. Typical dose, 1 tablet orally once daily, 11. Missed dose, overdose. Missed dose instructions, very detailed. If one active pill is missed, take the missed pill ASAP. Take next pill at normal time. Even if 2 pills in one day, no backup needed. If 2 active pills are missed, take 2 pills today, take 2 pills tomorrow. Use backup for 7 days. If T3 active pills are missed, continue taking daily. Use backup for 7 days. If missed in week 3, skip placebo week. Start a new pack immediately. If only Fe pills are missed, no impact. Discard missed Phe pills. Overdose symptoms may include nausea, vomiting, breast tenderness, vaginal bleeding. Treatment, symptomatic, and supportive care. Number 12, stop or avoid taking if warning signs. Stop immediately and seek urgent treatment if you develop blood clot symptoms, leg pain, swelling, sudden chest pain, shortness of breath, severe abdominal pain. Neurologic symptoms, sudden severe headache, vision loss or blurring, weakness, numbness. Liver symptoms, yellowing skin, eyes, dark urine, severe upper abdominal pain. Other, new migraine with aura, very high blood pressure readings, pregnancy symptoms. Number 13, side effects, detailed. Common, nausea, vomiting, breast tenderness, spotting or breakthrough bleeding, mood changes or mild depression, headache, bloating, weight changes, decreased libido, acne improvement or worsening. Serious, blood clots, DV, stroke, heart attack, liver enzyme elevation or tumors, gallbladder disease, hypertension. Long-term considerations, slightly increased risk of breast and cervical cancer, reduced risk of endometrial, ovarian, and colorectal cancer. Number 14, vital information, high-yield facts. Does not protect against sexually transmitted infections, STIs. Taking pills same time daily greatly improves effectiveness. Risk of blood clots highest during first year of use, restarting after long break. Smokers, obesity, long immobility. Antibiotics do not typically interfere except rifampin. Stopping pills may cause temporary irregular cycles. Number 15, drug interactions, very detailed. Reduce effectiveness of Junel, key concern. CYP3A4 inducers, rifampin, strongest interaction, rifabutin, carbamazepine, phenytoin, phenobarbital, primidone, oxcarbazepine, topiramate, 200 milligrams per day, St. John's wort. Other interactions, antiretrovirals, efavirenz, ritonavir, nevirapine, hepatitis C antivirals, risk of elevated liver enzymes, antifungals, ketoconazole, itraconazole, increase estrogen levels, lamotrigine, levels decrease, risk of seizures, thyroid hormones, may require higher thyroid dose. Alcohol may increase estrogen levels slightly, no major contraindication. Thank you, have a nice day.